Past papers multiple choice one-liners. One-liner number 1. Most sensitive and specific for liver necrosis is alanine aminotransferase, ALT. One-liner number 2. Hemoglobin binds with heptoglobin, and heme binds with HEMOPEXIN. One-liner number 3. Neural tube defect confirmatory test acetylcholine estrus more specific than alpha-fetoprotein. One-liner number 4. Betamethasone prophylaxis is given for fetal lung maturity in pregnant woman. One-liner number 5. Mother-child bonding FOSB gene. One-liner number 6. Heparin leads to hyperkalemia. One-liner number 7. Right bronchial artery is one and supplied by the third right posterior intercostal artery, and on left side there are two bronchial arteries that arises from aorta, reference RJ last. One-liner number 8. After moderate hemorrhage serum proteins return to normal in 3 to 4 days. Ref. Ganong. One-liner number 9. Sphenoid bone is an example of pneumatic bone. One-liner number 10. Bacteria adhere to cell membrane bypilli. Past papers multiple choice one-liners. One-liner number 11. Metastatic calcification is an important feature of hyperparathyroidism, but it can also occur in hypoparathyroidism. One-liner number 12. Coronary arteries anastomosis at arteriolar level. One-liner number 13. During appendectomy, iliohypogastric nerve is most likely damaged. One-liner number 14. Glucose is primary source of energy for fetal metabolism. One-liner number 15. During liver cirrhosis, caudate lobe is more likely preserved. One-liner number 16. Body temperature is regulated by preoptic area of anterior hypothalamus. One-liner number 17. PR depression is more specific for pericarditis. One-liner number 18. Small gut resection increase absorption and urinary excretion of oxalate leading to kidney stone formation, reference Davidson. One-liner number 19. Urine output of normal adult is 1.5 liters. One-liner number 20. Meissner's corpuscle for tactile 2-point discrimination. Past papers multiple choice one-liners. One-liner number 21. In infectious mononucleosis, infected cells are B cells and atypical lymphocytes or activated cells are CD8 and T cells. One-liner number 22. Exercising skeletal muscle does not depend on insulin for glucose uptake. Reference Sherwood. One-liner number 23. 10% of erythropoietin is also synthesized by liver besides kidney, while globulins are entirely synthesized by plasma cell. One-liner number 24. Deficiency of factor 12 leads to thrombosis in spite of bleeding. One-liner number 25. Factor 5 latent or factor 5 mutation leads to thrombosis. One-liner number 26. Factor 5 deficiency leads to bleeding. One-liner number 27. Normal mitral valve area is 4 to 6 square centimeters. One-liner number 28. Antimyoba histolytica lesion most common in cecum. One-liner number 29. Submandibular gland surgery nerve most common damaged is marginal mandibular branch of facial nerve. Other nerves involved includes lingual and hypoglossal nerves. One-liner number 30. Gastric ulcers most common on lesser curvature near incisura angularis. One-liner number 31. Increase activity seen where before the start of movement cortical association areas. One-liner number 32. PT is best indicator of hepatic synthesis function. One-liner number 33. Of all free radicals hydroxy O group is most reactive. One-liner number 34. Libman-Sacks endocarditis involves mitral and aortic valves. One-liner number 35. Most common nerve damage during thyroidectomy is external branch of the superior laryngeal nerve. One-liner number 36. Pubertal changes in order of sequence THELARCHE-ADRENARCHE-MENARCHE. One-liner number 37. Slowly depolarizing prepotential SA node. One-liner number 38. Most common complication of total parenteral nutrition hyperglycemia. One-liner number 39. In RBC cell membrane, chloride and bicarb exchange occurs through band 3. One-liner number 40. Submucosa's strongest layer of small intestine. One-liner number 41. Total sperms produced by 2 testes per day 120 million. One-liner number 42. Hypercalcemia and hypokalemia leads to systolic heart failure while hypocalcemia and hyperkalemia lead to diastolic heart failure. One-liner number 43. The medial geniculate body of thalamic nucleus lies on midbrain. One-liner number 44. Least irritating substance when free in peritoneal cavity is blood. One-liner number 45. Formaldehyde is used to prevent autolysis. One-liner number 46. Ependyma has no basement membrane. One-liner number 47. Frontal lobe lesion results in lack of motivation. One-liner number 48. Classic hemophilia deficiency of smaller component of factor VIII. One-liner number 49. Deep sleep results in loss of peripheral vascular tone and REM sleep results in loss of muscular tone. One-liner number 50. Shortest proerythrocytic phase Plasmodium falciparum and longest Plasmodium malariae. One-liner number 51. Group of muscles involved in Duchenne and Becker muscular dystrophy is deltoid. One-liner number 52. A patient is started on lithium, notices fasciculations in hand muscles after few weeks of treatment. Blood lithium level was tested and most likely is greater than 2. One-liner number 53. Pubic hair development due to adrenal androgen. One-liner number 54. To calculate plasma osmolarity, sodium is multiplied by 2 anions. One-liner number 55. Washed RBCs prevent allergic reaction. One-liner number 56. Short-acting benzodiazepines include midazolam and triazolam. One-liner number 57. Where is the pacemaker if no P wave present on ECG is at AV node? One-liner number 58. Most specific test for SLE is anti-Smith antibodies followed by anti-DsDNA. And most sensitive is ANA. One-liner number 59. The most specific diagnostic test for heparin-induced thrombocytopenia serotonin release assay. One-liner number 60. The gold standard diagnostic test for H. pylori infection microbial culture. One-liner number 61. In acute liver failure, best prognostic indicator is PT followed by factor V estimation. One-liner number 62. Which of the following is not characteristic of hypopituitarism cachexia? One-liner number 63. Which of the following is secreted from all three zones of adrenal cortex? Corticosterone. One-liner number 64. In newborn organ with almost same size of adult is the inner ear. One-liner number 65. Hormone produced in normal concentration during pregnancy. Growth hormone. One-liner number 66. 21-year-old having severe ulcerative colitis. Which of the following is indicated? Intravenous corticosteroids. One-liner number 67. Most common type of glomerulonephritis is immunoglobulin A nephropathy. One-liner number 68. Spinal cord is suspended in the middle of the dural sheath by ligamentum denticulatum. One-liner number 69. Knee jerk L3, L4. If L3, L4 aren't given as such, but L3 alone is given in options, mark L3. Main contributor of knee jerk is L3. One-liner number 70. Remnant of epiphyseal plate is epiphyseal line. One-liner number 71. Reverse T3 is abundant in body of fetus. One-liner number 72. Most important cells of chronic inflammation are macrophages and most abundant.